One of the things I learned this weekend was in-depth discussions about cosmeceuticals, about neuromodulators, soft tissue fillers, something that we don't see much in our meetings, in our specialty.
In terms of new products that I'm very interested in, Allergan is coming out with Litera 2.0. This formulation of Litera I'm very excited about because it has no retinol in it. So I can give it to patients that are pregnant, that are breastfeeding, that have issues with pigmentation.
We've all been trained that sun exposure is not something that we should go after, and this physician was showing that there's an increased life expectancy for people who do go in the sun, and sort of an increased overall enjoyment of life. So I think it's something that I tell my patients, even before I heard the talk, don't not go in the sun, but if you do, you need to protect yourself. I don't think it's going to change my philosophy, but it certainly made me rethink what I tell people.
We also talked quite a bit about growth factors, and one of the conversations we had is, are these tumorigenic for patients? And I think what we concluded is that there's not really enough data. There's some data from some companies, but there's not really enough data to decide whether or not we believe they're tumorigenic. So I think that each of the people on the panel was deciding for themselves in their practices what they were going to adopt.
Mark Taylor's talk about sort of this combination mega session for treatment of acne scars. And I think that really is something we could consider incorporating into our practice. I think there's patients out there who have significant acne scars, and although they realize it's going to be a process and there's going to be multiple treatments, perhaps we can do several modalities on the same exact day to give them more improvement with each treatment session.
I really enjoyed learning about all the different radiofrequency treatments that are available and how these lasers work and which ones work for different people. There's so many different niches now in the radiofrequency market, and that's been kind of the thing I was most looking forward to learning about this year.
Actually, some of the best presentations of this meeting were the presentations by the residents who were invited. For example, video dermoscopy. That was a presentation that was given this morning. I thought it was very interesting and something that I may add to my practice.
I was able to work with attendings who have a ton of experience and could give me advice on how to build a practice, how to advertise and market. And then there's a lot of pharmaceutical representation here and device companies, and they're all really fantastic about sharing information about their products and helping me get set up for my practice.
I really enjoyed hearing various speakers talk about using fillers to treat the back of the hands. That's something that I haven't been doing much in my practice up until now, but my comfort level went way up at this conference, and it's something that I'll be doing starting Monday.
I'm not a cosmetic dermatologist, so there's nothing I'm here looking to get that's technique or this or that or the other. But listening to the controversy and the real sort of thought stimulation that is going on in there really makes this meeting a lot of fun.